We are back with Ron and Nick and Ron.
Hello.
Today's topic is the conditions of mental illness and its impact on healthcare.
As times change, hospital needs change, and hospitals have to be prepared to adapt. A lot of times this means, renovating and reorganizing some of their facility spaces, or sometimes pulling them out. One situation we're seeing a lot now is behavioral health units kind of being pulled out of the emergency department and put kind of off to the side in a separate facility so that those people can be addressed.
If you think in an emergency department, it's very stressful times, and the folks are coming into the ED, and there's patients there that could be having a whole myriad of issues. And so to Nick's point, those suites, although still within the emergency department, are often broken off kind of to the side so that it can decompress the emergency department to help everybody get better care.
Right, because that's a space that you really want to de-escalate the kind of hype and excitement in an emergency department. And the people that need those behavioral health services need that same de-escalation, so they can deal with their conflicts. And so having a behavioral health space, a behavioral health unit, with its own identification and its name, gives some people this kind of oasis to go to.
Really important to just think it through, and how behavioral health in general is going to be taken care of at your hospital.
Right, and just thinking about the microclimate of those spaces as well as the macroclimate, kind of figuring out where these units are located, but then how each space is kind of interpreted by an individual. So when we work on our designs and when you look at our portfolio and on our website, you'll find that a lot of those spaces that we design kind of address those needs. So when we're designing these spaces, we're designing them for these specific people with these specific issues. So we try to integrate as much natural atmosphere as we can, whether it's, the water features or natural lighting, or just increased security so that these patients that are in there feel safe.
There's an awful lot of stuff to think about, so please feel free to reach out to us and see how we can help you create a better space to serve your behavioral patient needs.